at the National Rural Health Conference, and I have with me Bruce Arroll. Bruce, welcome.
Hi.
What's your background?
Well, I'm a GP in Manurewa. I've been there since 1991, and I also work at the General Practice Department, University of Auckland, where I'm one of the professors.
That's why you look so familiar.
Right.
Right.
Yeah.
And you're here today, you've got a booth here in the stand?
Yeah, we've got the Goodfellows. I'm also the director of the Goodfellow unit, and we've got a stand here, and our big promotion at the moment is the Red Whale, which is the GP update from the United Kingdom. So there's a group of GPs there who summarise and update all the evidence in primary care over the previous year, and then make it available in a course. And so the course will be on September the 1st, and people can sign up now for it. You get a big book, 400-page book, which people love. They just like to hold it sometimes. It's a lot of work. Yeah. And there's a 6-hour lectures on the day where we go through some of the items in the book. But you also have access to the website, which has about 300 PDFs on it. So it's a great way of just getting up to date. So that's September the 1st in Auckland.
And that's open to all professions?
Yep. Yeah. So it's aimed at GPs and primary care nurses and pharmacists, but anybody who wants to come can come, and we need the support.
Okay, well let's talk about your talk that you're going to be doing.
Right.
So it's, are antidepressants effective in primary care? So I guess I have two questions.
Yep.
Are they effective, and are they effective in primary care?
Well, probably the first answer will be both, yes to both those things, but you have to think about who meets the criteria for major depression. So it's been shown to be effective for patients who've got a major depressive disorder at a moderate to severe level. And that's actually a minority of the patients we see in general practice. So of the patients we see on day one, it's very much a minority of the patients we see. And a lot of the patients who look severe on day one, in fact, are much less severe a week later, 2 weeks later. And the key thing is when people get an emotional issue or a mental health issue or are distressed, they shrink their lives. So they stop doing things and seeing people they used to do. And I don't think we should be giving antidepressants to people until we've tried expanding their lives. I like to say getting them back in the river of life, getting back and doing things. And if you can't expand their lives and they're still stuck, which is the diagnostic term I now use, then you might want to think about antidepressants. I think that would be a much more rational basis. So we're not just slinging antidepressants out on people at the first visit, which I don't think is the right thing to do in most cases.
Okay, and so this river of life that you talk about, is it people are sitting on the bank and me trying to get back into that river?
Yeah. Well, if you're distressed, and we know this from medical school, when we get an exam, we shut our lives down, but we usually expand it afterwards. People, when they're depressed or anxious, shut their lives down, and that solution becomes part of the problem. So that's the problem with mental health problems. Common mental health things, depression and anxiety, is the solution becomes the problem. So the solution is not to do things and see people because it feels easier in the short term, but that of course is harmful in the long term.
Yeah.
And we want to have people who are flexible and flourishing, and you can't be flexible and flourishing if you're sitting on the bank watching everybody else.
Go by.
Yeah.
And so how long would you let someone sit on the bank for before you...
Well, it's very contextual. Sometimes if people have tried a whole lot of things and they're not working and they're going to lose their job, I might be a bit quicker to give an antidepressant, even though I think it may not work. So it's very, very contextual. I think you have to take the patient's circumstance, their desire for drugs. If people are wanting drugs, I sometimes say, well, can we just wait and see how you do? In my experience, most people get better if they start doing things. Exercising is an important thing, getting out and contacting their friends and doing things. And we know behavioural activation is one of the best therapies for depression.
I guess you could liken that to the flow of the stream.
Yeah.
How fast that stream's going for that person's life and what the current is.
Yeah, if the current's a bit slow, then you might want to fling something in to help them. But I think keeping the antidepressant gun in the holster should be the starting point. I think we're far too quick to prescribe antidepressants at the moment.
And these observations that you've made, or these decisions you've made in GP practice, this is based off a study that you had done, is it?
Well, some of it's informed. Yeah, we did the systematic review of antidepressants in primary care, and the drugs came out looking effective. And then I thought, well, how severe were these patients? And when we looked at the severity, the vast majority of the studies were done in severe or very severe depressed
Right.
patients,
Okay.
which is not the patients we see in primary care. And I think it's very hard to say someone's got a severe depression at the first visit if you haven't tried expanding their life. So that's why I'm keen to get people to expand, reverse that constriction, get them back, see what they're doing. And a lot of people, they'll have quite high depression scores on week 1. Often a week later, once they start doing things, their scores will come down. And if you give them an antidepressant, you would have thought that had done the trick. Whereas in fact, actually, they've done it themselves. They're the ones who have expanded their lives and got things going again. So.
Fantastic. I can liken you to like a lifesaver on the edge of the water.
Oh, I really like that. Fantastic. Yeah. I have to improve my swimming skills, but yeah. At least a life belt.
Life belt.
Yeah.
Cool. Thanks so much for coming along today,
Okay,
Bruce.
yeah,
I
it
look
was
forward
lovely to
to
be here.
hearing
Yeah.
you talk.
Thanks.
Okay.